Welcome to the Summit PT Podcast, your guide to recovery, performance, and wellness. I'm Dr. Kevin Koska, a physical therapist, and today we are going to be meeting again with Dr. Hayley Davis, an occupational therapist. Today we are going to be discussing Parkinson's disease. We're going to be learning some adaptive strategies that Hayley uses in the clinic, as well as for those that have Parkinson's, some adaptive strategies for them to utilize at home. And we're going to be learning different techniques that she uses in the clinics, as well as some of the exercises that she would be doing as part of a home exercise program for somebody with Parkinson's disease. In this episode, we also talk about stroke patients and what we utilize inside the clinic, some new techniques that are out there, such as the mirror strategy, or utilizing electrical stimulation to get some crossover from the involved side to the non-involved side. And we are going to learn some other adaptive strategies that are utilized at home to become functional again following a stroke. Let's go into Parkinson's.
Yeah.
The big program, or Big and Loud, that's one thing that is that may be familiar to those out there, but let's just kind of back up a little bit. And how does Parkinson's affect our movement, one, and then two, related to the OT, like daily functional stuff?
Yeah. So Parkinson's has the change in the brain that inhibits normal signals being passed through the neurons from the brain to the body. And so we mostly see a lot of rigidity, loss of range of motion due to that rigidity, and then tremors and motor control issues. They have a lot of bradykinesia, so it's slow movements and small movements. So when a normal person is walking, they're taking full strides, whereas someone with Parkinson's, you'll see one side of their body swing less and not step as far, and then their posture comes down and their eyes are down and they start to get into a shuffle step, which impacts a lot of their balance and coordination, safety with motor movements throughout any environment. And then a lot of things that I see is tremors. So working on hand coordination, strength, and adaptive strategies, again, to keep them independent.
You know, I'm going to ask you about the adaptive strategies that you use.
For tremors is a big one that we use adaptive tools for. So weighted utensils, bracelets, and tools. So eating is a big one that people are frustrated with. So we try weighted utensils, such as weighted spoons, forks, knives. The extra weight of the utensil can help just stabilize their hand a little bit, because it takes more muscle and more strength to be able to go through the movement, and it actually steadies them a little bit. There's some cool accessories that people have started coming out with, like bracelets or watches with extra weight on them, so that it doesn't look like, oh, I'm just putting a weight on my arm to control this tremor. Now it's an accessory that's hidden, and people aren't just staring at you like, why is that there?
That's smart, yeah. What are some of the biggest challenges that you see with your Parkinson's?
The number one thing that I see people talk about first is their balance and their coordination. They feel like they have to walk slower, or they're more fearful of falling. And then the next one is a lot of tremors. Like they get weak and aren't able to dress themselves or bathe themselves like they want to. And so those are two of the big things that they want to keep independent, because it becomes a modesty thing and something that it's so personal that it's not something that you want to have to ask to get help from somebody else. So those are some of the biggest things that people want to work on when they come see me.
So from a technique standpoint, you do your adaptive strategies, weights, heavier or weights around their arms or their legs, or heavier utensils. You work on their balance. What other things do you guys utilize to help with Parkinson's, to help with the shuffling gait or the smaller movements that they make?
Yeah. So I do a lot of amplified movements. I initially learned it from learning about the LSVT big certifications. Parkinson's slows down the movements and makes them smaller. So we're trying to recalibrate or get their perception of their body back to what it should be. So we do over-exaggerated movements with full body coordination activities, both in seated position and standing position, to help normalize that movement. So they might start really slow, and then we're working together to make it as big as they can. So they're trying to copy me, and
that's when I hear you all the way across the room, right?
Yes.
Yeah.
Like, you gotta be louder than me. You gotta stomp as loud as you can.
Yes.
We're gonna make everyone pay attention.
Absolutely.
It's a lot of fun.
Absolutely, yeah. Everybody's always having fun when the whole clinic usually is. So I always like to see that. So when it comes to those, the bigger movements and the louder movements and the other therapies, how long do you usually treat them before you start to notice some type of improvement? Because you'd have to imagine with a neurological condition, it takes a long time. When I say a long time, I'm just generally speaking. What is a long time to start to notice? Is it 2 weeks? Is it 6 weeks? What is it?
It really depends on where they are in the stage of Parkinson's. I've luckily had the experience to be with people early on in it, and they see, just from getting the home exercise plan and starting to build consistency with that, they see it really fast. They can see it within 2 or 3 sessions, whereas somebody that's further along in the progression of Parkinson's, maybe wheelchair bound already, they're going to see much slower progress, and it can take a couple weeks.
I would imagine that they have to continue with a home program after treating them for 6 weeks, 8 weeks, whatever it may be.
Yeah, and I try to get them to have a really high intensity, so they're being educated on the importance of the exercises and doing them every day, if not twice a day, and then being consistent every single day. So if they can be more consistent with not only their exercises, but also their medications going on at the same exact time every day, or close to within at least like an hour or 2 hour window, keeping it as consistent as they can. So the more routines they have, the more their body adapts to that and can establish more rhythm and be more comfortable with it.
Absolutely. Do you have any success stories that you've seen at any of the clinics with some of the Parkinson's patients?
Yeah, I had a gentleman that we were working on balance and coordination. He had some swelling in his hand. So we worked on stairs because that was a big one for him. He wanted to be able to travel with his wife still and be able to go up and down stairs at his family's house. They had a really wide handrail, and so we were actually in our Hickson office for that, and that's connected with the sports barn. The sports barn had a perfect railing, so we would go up with the railing that was thick and work on getting all the way up the stairs. By the time we finished, he did not have to stop at the landing and was able to make it up, I think it was around 30 steps, take a break at the top and make it down safely.
That's awesome.
And then swelling improved a lot on his hand through motor activities and
just
self-massage.
Moving around, right?
Mm-hmm.
Yeah. That's fantastic. Well, let's move on to not Parkinson's. Let's move on to stroke rehab. We'll finish up with Parkinson's and move on to stroke. I'm sure there's a lot of people out there that are listening or watching that know somebody, a friend or a family member that has had a stroke. Can you go into a little bit of detail on what stroke can actually impact on somebody?
Well, stroke can impact just about everything. There's motor deficits that you see, cognitive deficits, visual deficits, and emotional deficits that can change. With a stroke being in the brain, it can actually affect every single part of you. So people most commonly see a one-sided weakness. And so they will
Is there a left versus right, or?
For whatever reason, left-sided weakness tends to be more common. Not really sure why that is,
Okay.
but I see left-sided weakness more often than right, which is great since the majority of the population is right-handed.
Sure.
So that's definitely helpful for most people.
Spasticity.
We got spasticity. So we do contracture management, which is just the muscle being tightened and stuck in one position. Putting splints and teaching people self-range of motion, stretching techniques, weight-bearing techniques, and also keeping them on a regular exercise routine as well.
There's one thing that is it's new to me. It's probably been out longer than what I've seen it, and I've seen it used at our clinics in Knoxville as well, is where they use the mirrors. Yeah. And they explain what the mirrors are and what's going on there.
So mirrors,
and you can buy them for $10, or you can make your own for something cheap.
Yeah, mirror therapy is really cool. It's pretty much tricking your brain to resending the signals down to the right hand or left hand, whichever one it may be. I've used full body mirrors to where we get both hand and leg if both are affected. But what it's doing is helping re-establish those connections from one side of the brain to the other to send the proper signals back to your affected limbs. And so it comes with, you want to have high repetition. So you normally see people put on a timer and they have to watch their body move in the mirror. So you're moving your unaffected side in the mirror.
And you can't see this side.
And you can't see your affected side. So you have to sit really close to it and make sure you're looking at the mirror so that when you look in the mirror, it looks like it is your affected side.
Right.
So I still have people try it at the same time. And I've also done a hand-over-hand taping. So I actually will come in, put my hand on top of theirs, tape our fingers together. And so while they're doing the mirror therapy, I'm moving their hand if they have really limited motor control. And then they get to feel it a little bit, get that motor control, as well as visually see that it's happening.
That's awesome. Yeah, I saw that one of my friends' dads that I grew up with. He had a stroke, and I started researching a little bit on it because, like we think, we're always wanting to help everybody and anybody, and we know that we have the tools to be able to do it, and started seeing the mirror therapy and started researching it and hearing how successful it was, and reading the research. It was all about the crossover from one side of the brain to the other, and how it was how effective that strategy was to help people be able to get some movement back in their hand. Obviously, you still have to work through the spasticity or the synergies that they've reverted back to. But if it is possible to work some of that spasticity out, they can get some of that movement back in their extremities.
Mm-hmm. Something else that's helpful to add before it is visualization, which a lot of athletes use. Visualizing it first for a couple minutes and then attempting it can help a lot of the connection to help with the mirror therapy be effective.
That's awesome. Yeah, athletes use that all the time if it's for free throws or putting or whatever it may be. So I can definitely see the benefits of using that. Since we're on the technologies, any other cool technologies that I'm just not aware of that's out there for stroke? I've seen some that they've got little gloves that they can put their hands in and start to move around.
There are a lot of upper extremity and lower extremity devices that you wrap around your limb, and they place electrodes in the muscle or on the skin where the muscle should be activated. So if you still have signal that if you're trying to activate that muscle, the signal gets to the electrode and still controls the arm. Sometimes they might put the electrodes on the opposite arm, so you're retraining your affected limb by moving your unaffected limb.
Right.
But since the device is on there, it'll move that affected limb in the same way that you're moving your unaffected limb.
Yeah, again, we're going back to that crossover. Some of the newer stuff on our side of the table or our side of the clinic is the blood flow restriction therapy, and that's where if you have an injury on the right side, you actually put this on the left side, and it cuts off some of the blood flow and helps to stimulate more blood flow, but it works on the opposite leg. So yeah, there's a lot of crossover that's going on there. That's pretty cool. So working on fine motor skills, working on cognition as well, and then working on adaptive strategies, and then getting them as independent as possible. Could you walk me through something that you would do with a stroke patient that maybe you have going on right now, and give the audience a little bit of a better idea of what you do and how you do it for a stroke patient?
Yeah. I just had a treatment yesterday with a stroke victim that he has decreased sensation from head to toe. So we have incorporated anodyne therapy, which is a red light laser, and paired it with nerve glides to help re-stimulate the nerves to send proper signal for the sensory input. And then we move into exercises like weight-bearing activities, doing a bird dog, which is being on your hands and knees and reaching out with opposite leg and opposite arm.
And putting pressure through those joints, approximation.
Yep, it helps with proprioception, strength, coordination.
So they can actually feel it, try to feel it. You can push down into their hand, right?
I've also done the bird dog exercise with electrical stimulation. So putting it on the tricep to keep the elbow straight, rather than having to be there to support that arm. They had enough muscle activity that they could straighten it, but they couldn't hold it and hold their own weight. So I activated their tricep with the E-stim, and they were able to do it independently from there.
Oh, wow.
With fine motor, I do a lot of games, actually. I have little tools that we do, hand games like Chinese balls, where you just twist them in your hands. We've played pop-up games where you have to press the middle dice, let it pop, and then you try and move the piece. Being able to actually pick up those pieces, and then I'll have them switch which finger they're trying to pick it up with to work on the different fine motor skills. We've played cards to work on cognition, them teach me a game or try and learn a new game, and then remember the instructions so that they can then play the whole game. And then I grade it by giving different cues or handwriting out the instructions or rules, or giving visual cues and things of that nature.
That's awesome. Any type of success stories that you've had that you're like, man, I got to tell you about this patient, this CVA, this stroke patient that I've had?
Guy yesterday actually discharged.
Okay.
He came in, he had maybe 50% of his sensation in the right side of his body, and he was able to get all of it. He still said it felt diminished, but when testing him, he was able to get everything correct. So he tested at 100%, even though he was saying that it was still a little diminished. So that was a lot better. And then he has been able to get up and down out of the floor more independently and more confidently.
That's a big challenge right there.
Yes, and he has 2 young girls, so he stays active, and they also have a lot of farming, and he does sourdough that he's been able to do on his own. So he was super, super thrilled to be able to say that he's regained enough function that he's not having to ask for help on everything, and he's able to carry heavier weights and be able to take care of his girls more independently.
That's awesome. Well, have I worn you out yet with all these questions?
No, let's talk forever.
Right. So today, I appreciate your time and taking the time to come over here and chat with me. So today we learned about the difference between PT and OT. We talked about some of the conditions that, generally speaking, what some of the conditions that OT treats. I learned a lot of different adaptive tools. I've learned a lot of different techniques that the OT clinicians would utilize. We talked about your different goals that OTs will set for very similar type patients. We talked about the driving rehab, and all the adaptive strategies there, the cognition, the ocular motor, just the visual, the depth perception, even the neck rotation. We talked about low vision rehab, again, the ocular motor strategies, as well as the adaptive tapes and different types of adaptive strategies that we could utilize. We talked about Parkinson's, so we talked about the tremors and some of the smaller movements and the shuffling gait and how to exaggerate a lot of the movements and balance specifically with the Parkinson's patient. We talked about, look, I'm rattling all this off here. We did the stroke rehab. I know, me too. We did but I can't remember somebody's phone number, right?
That's okay.
We talked about stroke rehab, and we talked about the mirrors. We talked about using electrodes and electrical stimulation, getting up out of the floor, and the crossover again. So, man, we learned a lot about the difference between PT and OT and what how you can help just about anybody out there if they are starting to age and need some help, or if they haven't aged and have had a stroke or some kind of a traumatic brain injury, something that can really debilitate somebody. So I appreciate your time, and if anybody out there needs Hayley's help, feel free to reach out to us at summit-therapy.com. Thank you for your time.
Thank you for having me.
Yeah.